Gestational diabetes. Created by Sydney, Vaishu, Sarah, and Joe. First, we are going to explore the role carbohydrates play in gestational diabetes. Gestational diabetes, or GDM, is hyperglycemia first recognized during pregnancy. Common symptoms include increased thirst, frequent urination, or unusual fatigue. GDM shares similarities with type 2 diabetes, including higher intake of simple sugars, insulin resistance, and increased inflammation. Pregnancy naturally creates an insulin-resistant state due to hormonal and metabolic changes, so the type of carbohydrates consumed plays a major role in blood glucose control. Carbohydrates don't all act the same in the body. The glycemic index, or GI, ranks foods based on how quickly they raise blood glucose. High GI foods cause rapid spikes in blood sugar. Low GI foods lead to slower, steadier increases. Low GI diets have been shown to help reduce the risk of infants being large for gestational age and prevent macrosomia. By keeping glucose levels stable, low GI eating supports healthier fetal development. A Mediterranean-style diet is naturally low GI. It emphasizes vegetables and omega-3 fats, which help reduce inflammation. In contrast, the Western diet is high GI, filled with refined carbohydrates that promote oxidative stress. This makes blood sugar harder to control and increases risks for both mother and baby. Now let's discuss how fats and lipids impact pregnancy with gestational diabetes. With gestational diabetes, lipid levels shift, especially a decrease in high-density lipoproteins, HDL, the good cholesterol. These changes contribute to inflammation and insulin resistance. Because insulin resistance weakens the body's ability to regulate fat, more fatty acids enter the bloodstream. These fats move to the liver, leading to buildup and inflammation. In the liver, excess fat increases VLDL or very low-density lipoprotein production, which raises triglyceride levels. This cycle of high fatty acids, VLDL, and triglycerides contributes to GDM progression. These lipid disturbances increase risks for non-alcoholic fatty liver disease, obesity, C-sections, cardiovascular disease, and type 2 diabetes. Unsaturated fats and omega-3s reduce inflammation and improve insulin sensitivity, lowering GDM risk. Saturated and trans fats increase inflammation and worsen insulin resistance. Low-density lipoproteins and triglycerides naturally rise during pregnancy, but these increases are much larger with gestational diabetes. Gestational diabetes, and diabetes overall, can cause, as well as can be caused by issues within the GI tract and microbiome. When individuals experience hyperglycemia, which is increased blood sugar, this can result in the formation of reactive oxygen species in the blood. These molecules damage the intestinal walls and cause something we call leaky gut. Leaky gut refers to a breach in the gut wall, which can allow bacteria and toxins to enter into the bloodstream, eliciting an inflammatory response. The inflammatory cytokines, a part of this response, travel through the blood to the toxin site. During this, they can disrupt the transmembrane insulin receptors within the body. Ultimately, this leads us back to a state of hyperglycemia, and thus repeats this cycle. This hyperglycemia can also slow gastric emptying into the small intestine due to decreased intestinal peristalsis, which is caused by damage via the reactive oxygen species. This causes food to move through the digestive system slower, allowing for the buildup of pro-inflammatory bacteria in the GI tract. These bacteria compete with themselves, as well as with the body, for the nutrients from the food moving through. As a result, nutrient absorption is decreased within the body. Vitamin B12 is a nutrient that is affected by this process, and a lack of this vitamin can directly cause neuronal damage, as this vitamin is critical in the production of the myelin sheath. The difference between type 1 or type 2 diabetes and gestational diabetes is the fact that these gut microbiome issues are not only occurring in the mother, but are simultaneously being seeded into the growing fetus too. As a result, the fetus has a microbiome deficient in probiotic bacteria that are crucial for fermenting fiber into short-chain fatty acids like butyric and propionic acid. Due to this, the fetus will be more prone to issues pertaining to immunity, excessive weight gain, and increases susceptibility of developing diabetes of their own. Nutritional genomics in gestational diabetes. Nutritional genomics is how genetic variation influences response to nutrients and vice versa. Pregnancy is a metabolic stressor. It reveals underlying genetic susceptibility to glucose intolerance. Gestational diabetes interacts with diet to shape insulin sensitivity, beta cell function, and maternal glucose levels. Genetic variants influencing GDM in LCUD TCF712 and GCK variants. Those with TCF712 should consume low glycemic, higher fiber diets. Those with GCK should consume a greater carb distribution diet. Diet can upregulate or down-regulate genes involved in glucose metabolism during pregnancy. Fiber and whole grains improve the expression of genes related to insulin signaling pathways. Omega-3 fatty acids influence glucose homeostasis, enhancing insulin sensitivity. Micronutrients support all epigenetic processes. Elevated maternal glucose alters fetal DNA methylation in genes regulating insulin sensitivity, adipogenesis, and appetite control. A high-quality maternal diet reduces harmful epigenetic changes and lowers the baby's risk of childhood obesity and type 2 diabetes. That's all for gestational diabetes mellitus. Thank you.